Challenging behaviour has a tendency to occur in response to a patient's distress to certain situations, interventions and events. There are common physical, cognitive, psychological, emotional and environmental factors that, combined with an individual's unmet needs, may trigger challenging behaviour. So it's important to stress that challenging behaviour commonly results from a patient experiencing problems communicating their needs or difficulties in understanding and interpreting the communication of those around them, and can all lead to distress or difficult behaviours. Challenging behaviour may be part of an underlying illness, and staff need to be skilled in establishing any underlying causes. In A&E, little is often known about the patient, and it's important that staff do not jump to conclusions about the reasons for someone's challenging behaviour. For example, that they are drunk or just being difficult or aggressive. There may be an underlying clinical reason for their behaviour that needs to be quickly established. Working as a multidisciplinary team is crucial to gather information about the reasons for someone's behaviour, and this should start with a good handover from ambulance crew to A&E staff. Dave has arrived at A&E. His speech is slurred and he is physically swaying from side to side. As staff try to communicate with him, Dave becomes loud and potentially aggressive, unable to concentrate on the questions being asked by staff, and he shows signs of disorientation, agitation and forgetfulness.
Yesterday.
Okay. What kind of time? Do you remember?
I don't know.
Okay. And out of 10, if 0 is no pain, 10 is the worst pain you can imagine. What's your pain now?
10.
Okay. We'll get you something for the pain shortly. Hi, Mike. This is Dave. Do you want to just do some obs for me? He was found by a passerby on the street this morning, feeling a bit confused. He has been slightly agitated. They thought he might be intoxicated, but they then did his obs and they found that his temperature is 39.
An approach of talking and listening to patients, carers and their relatives is important to gather information about the possible causes of their distress.
So a bit tachycardic, pulse 111. Reduced cap refill and slightly reduced GCS. GCS is 13 with them. And they've noticed a rash on his chest. I'll show you. Dave, can we just have a look at that rash on your chest? Is that all right?
Yeah. Can I just go home?
Not yet. We just need to try and find out what's wrong. It's just here. It's a non-larching rash.
It is vitally important that clinical teams make a judgment as to whether the patient has any potentially life-threatening injury or illness that is responsible for their behaviour, and whether life-saving treatment and care must be given immediately. The gathering and sharing of information will assist in establishing if there are any underlying causes of a person's behaviour and determining the need for immediate or longer-term treatment and care. Finally, sharing this information with colleagues when the patient is transferred is absolutely essential.
Okay, if you just look straight ahead for me, just open your eyes slightly. Just open your eyes a bit more, that's great.
Oh no.
I'm sorry, Dave, this is just really important so we can assess you. Is that alright? You just open your eyes. I'm sorry. One more. Okay. So pupils equal reactive to light, and with the rash, during meningitis.
Yeah.
In this situation, Dave was suspected of having meningitis, and intravenous antibiotics were immediately administered before staff continued with their assessment.
I think the first thing is to try and always think about what's the cause of this challenging behaviour. So there's a number of things: pain, confusion, alcohol probably are the commonest ones. And really have that in mind when you're seeing a patient. And then actually the approach is the same whatever the cause is in some ways, in that you have to stay calm, you have to be non-confrontational, you have to be really listening to the patient. There's a number of occasions when I've listened and I've figured out why the patient's quite distressed or whatever it is, and then that's really just brought them down. The ambulance crew will have been at the scene, and the scenario they have compared with what we have, a neatly packaged patient on a trolley, They can tell us what was happening at home, they can tell us who was there and what they've heard. They write all that stuff down, and that's in their ambulance handover sheet. So if, as a doctor, I haven't actually heard the ambulance handover, it's usually all there, and that's a really important document to look at. So if a patient's having difficulty communicating, it's about working out why that is. They may be deaf, they may be confused, they may just be in pain, they may have a borderline personality disorder, in which case the strength of their emotions is just preventing them from communicating sensibly. So it's figuring out why and then trying to work out what's going to help them. Sometimes putting them in a different environment helps, sometimes having family around helps. Sorting out their pain and coming back to them later may help. All sorts of things we can do. So the environment, I think, plays a big part in how patients are. They're worried, they're confused, I've come to a department which is really busy, they've met any number of different people. They may be aware of lots of other things happening around them. Sometimes just taking them to a quieter room and closing the door is helpful, and just letting them calm down. Having family come in can be very helpful. They may know why their relative is under stress or whatever it is, and can help deal with that. They may also give us clues as to what's been happening and why they're confused. We often call family to come in when someone's distressed and say, please can you come and sit with the patient, because it's much more effective having one of them than using one of our staff members. What we do is, it's all teamwork and involves communication. So when we're seeing the patient, we need to get all the information we can. So often my senior nurses have picked up quite a lot more about the patient. The ambulance crew, the HCAs have been observing, they've been sitting with them, trying to calm them down, can tell you stuff. So it's gathering all that stuff together, and then once the patient goes to the ward, if you're not careful, you can lose all that. So unless I write good notes, and unless the nurse does a good handover, the ward can start again with all that challenging behaviour without all the information to help them. So my top tips would be to be calm, to be really polite, to listen to the patient.